I'm Dr. Nancy M. Bennett. I'm a professor of medicine and public health sciences here at the University of Rochester, and I'm also the director of the Center for Community Health and the director of the Clinical and Translational Science Institute Community Engagement Key Function. The Center for Community Health is a center dedicated to working with the community to improve health in the Rochester region and to eliminate disparities in health status throughout the region. We work with the community very, very closely. We also work with many faculty members and students and staff at the University of Rochester. Our role in the Clinical and Translational Science Institute is to really be the open door between the community and the CTSI, as well as the rest of the institution. Our goal is to bring community members into the University of Rochester so that their voices are heard in the kinds of research we do, and conversely, to help our investigators go out into the community and work more closely with community individuals and organizations. There are many partnerships ongoing. We do research in both chronic disease prevention and communicable disease prevention. So to start with the chronic disease prevention, most of our focus is on health behaviors and how to help people improve their health behaviors. And that, of course, includes things like smoking and reduction of tobacco exposure, nutrition, stress management, and then also medication adherence. We do a number of research studies that relate to those issues, but we always do them with as much community input as possible. And we've heard from our community over and over and over again that these are major concerns for the community. Another example is in the realm of communicable disease. So for many, many years, we've worked with the Centers for Disease Control to do surveillance for emerging communicable diseases, and also to test the value of various interventions, whether that be vaccines or different ways of doing things. In recent years, this has become much more community-focused because of the interest in healthcare-associated infections. So we work very hard to prevent these infections and have had an enormous impact actually across all of the healthcare systems in Rochester by reducing the rates of healthcare-associated infections and studying their etiology so that we can then implement additional preventive measures. We focus a lot of our attention on community-based participatory research, which is a particular kind of research and implies particular methodologies. So we have staff who are really expert in that approach to research, and we work with people across the university who do this form of research. We also are interested in other levels of research, so not every project is going to be participatory. Not every project really engages the community at that high a level. Many of our research projects are ones where we get community input, but they may not be deeply engaged throughout the life of the project. In whatever case, whichever kind of research we're talking about, what we attempt to do for our investigators is to really help them reach out to the community. Again, the open door concept. So we actually take them out into the community to meet community members or to meet organizations in the community that might be interested in their research. We also staff a community advisory council, which is a group of leaders in the Rochester community. And that council really helps us to understand what the community's interests are, and also they provide very specific and direct input into research projects as they are under development. Another thing we do is to provide consultations to investigators. So we might say, gee, you know, this particular aspect of your methods is really going to be difficult in the community, and you might not want to do that. Similarly, we have a primary care research network, and we staff that. But in addition, we have another advisory group made up of practicing clinicians, and they will say to an investigator, gee, we'd really like to help you recruit patients from our practice, but if you make it that hard for us, we can't do it. They also give us lots of ideas about quality improvement projects that have research implications. So generally, we provide a lot of matchmaking between the community or community physicians and investigators at the University of Rochester.